Hello, you're watching NTV Houston. This is Saira Chauhan. As millions are mandated to remain at home to curb coronavirus, but other side, domestic violence, sexual assault, and child abuse cases are on the rise. Women and children at higher risk of violence and sexual abuse during coronavirus lockdown. So we'll talk about on this very important topic, and for that we have very special guest. So now we have joining Xiao Gwen, who is Chief Public Strategies Officer for the Houston Area Women's Center. Thank you for joining us today on NTV Houston. Xiao, how are you?
I'm good. Thank you so much for having us, and hope you are well and safe.
Yeah, I'm good. Okay, as we know that April is Sexual Assault Awareness and Child Abuse Prevention Month. My first question is that nowadays with people remaining indoors due to coronavirus pandemic, is there a rise in cases of sexual assault and child abuse?
Well, as this whole community is working to flatten the curve, we're all in this together. I say we're all in this together to flatten the domestic violence curve. Domestic violence has spiked since the outbreak of the coronavirus and the stay-at-home and quarantine measures. We're seeing an average of 60 to 80 calls every single day to our 24/7 hotlines. More than half of those calls are from women and children desperately seeking help. So what we've done as an organization is we've kept our operations open. We're considered an essential service. So anyone who needs help, support, a request for shelter can call the hotlines. We're going to do everything we can to ensure the safety of women and children during this epidemic. Our hotlines are open. Women, children are calling us saying, I got to get out, but I can't get out. I'm trapped in my home. Abusers are threatening women saying, you can't leave because I have coronavirus and you can't get out there because you're going to, infect others. I heard a heartbreaking story today from one of our hotline advocates who said a nurse called. Can you imagine, after a long day of working on the front lines, trying to combat this pandemic, she comes home to an abusive partner, berating her, isolating her, controlling her, and escalating things at the home. So that's what we're dealing with right now. What we do want survivors to know is help is still available. They can just call 713-528-2121. That's our 24/7 hotlines. Talk to an advocate. We have tips for how you can manage during this crisis. It's something that's been really challenging for our advocates. Safety planning is paramount to everything we do. So we have done a number of safety plans on the telephone with survivors, because the most important thing that they need to know is that their safety is the most critical time, and what do they need to stay safe.
As you were saying, 60 or 80 cases are coming regularly, and if I'll ask, what is the total data with regards to such cases?
I'm sorry, can you ask the question again? I couldn't hear you.
As you were saying, 60 or 80 cases are coming regularly, as you said that. And my question is that, what is the total data with regards to such cases?
Some of the cases, then they vary call to call. A lot of women are asking for shelter. So if we can't put them up at our 120-bed shelter, because all of the shelters in the Houston area are full right now, and dealing with, communal living. So we're trying to impose safety measures like, social distancing, wearing masks and gloves and hand sanitizers. If we can't put them in our shelter, we do the best we can to do something we call safe harbor, put them through a hotel program that we have. We've housed nearly 30 families since the onset of this. And for us, that was around March 13th when we closed our counseling and education campus. Some call for support. Some are saying, can you imagine, a lot of people right now have lost their jobs, are worried about finances, and now they're home with their abuser, right? With nowhere to go, and maybe within earshot if they're calling the hotline. So we're looking at very desperate times right now, and we are very concerned, but we want survivors to know that we are here to offer safety planning, support, and shelter by phone. And we are offering all of our services virtually. So if you have a counseling appointment, if you want to do an intake appointment, if you want to talk to our children's counselors, we are still here for you.
Okay. Xiao, how and who can one report about sexual assault and child abuse?
You know, both of those situations are already underreported. We know that. Being Sexual Assault Awareness Month, a lot of survivors, what we're hearing right now, we have a sexual assault hotline too, 713-528 RAPE. A lot of them are calling for that support. A lot of them miss the support counseling we have. We have support groups, 40 a week, that we've had to temporarily suspend because we can't meet in person. They're asking for support. We still have our hospital accompaniment program, which is, you know, survivors go to the hospital and they are treated by a sexual assault nurse examiner and need that kind of care and support and access to resources. A lot of those hospital runs have been suspended because of COVID-19. So we're very concerned about that. The other thing we're concerned about is children being at the home in stressful environments. We have a case right now in which there was domestic violence in a home of 4 children. Well, one of the children is an adult. And so CPS came and said, hey, do you want to take custody of your siblings? So we're working through that. I mean, we're hearing of a lot of unsettling situations. The Houston Police Department's also reporting a spike in their family violence calls. Their police officers going out. So we're doing all we can. And right now, we are working with the city and county to create sort of a citywide, countywide campaign to share this message, to tell survivors that we and other agencies and partner agencies are here for them, and that, you know, they can get help.
Okay, Shao, ma'am, my next question is that how badly does such incident affect the victim's mind, or I should say psychologically?
It's funny, people think of domestic violence and the first thing they think about is physical violence, but at the root of that physical violence is the emotional violence, right? And power and control, the need to coerce somebody to maintain control over them. Physical, psychological threats, taking away your phone, stalking you, those are all forms of violence. And the other thing, what we know is, you know, that financial empowerment piece is so important to our survivors. You know, access to resources and threatening the kids. You know, money and kids are the 2 barriers for survivors to leave, and that's being exacerbated right now by COVID-19.
Shah, my another question is that what assistance is provided by the government for victims?
You know, we at the Houston Area Women's Center and many other agencies, we do get support provided by different channels of funding through the government, through federal grants and state grants. We are still working with our partners in those areas to maintain that funding. So yes, we're very concerned about funding just like everybody else right now. But what I can tell you is we're still a full operation considering an essential service because it is essential to save the lives and protect survivors. It is essential that their safety is important. And this might seem like a private matter, interpersonal violence, but this affects all of us, from the families to the children and the witnesses who witness violence, to the first responders, the police officers, to healthcare workers, to entire communities. This issue of violence is a public health crisis, very much like a pandemic. It's everyone's problem.
Okay, Shao, what measures have been taken by the government to spread awareness and prevention?
You know, we've had some funding through the 3rd round of the stimulus package. We are lobbying for more funding for sexual assault and domestic violence survivors on a national scale. I would encourage everybody in this community to call our senators, Senator Cruz and Senator Cornyn. In fact, we will have a template and a message that you can leave a message on their phones. That's how we lobby to ask for more funding. We need more funding. We need more policy changes to protect survivors, those in vulnerable communities, those in our immigrant communities, those who are marginalized. That's one effort. And then on the local front, we feel like we have powerful allies in the city and the county to share this message, to tell survivors that we're here for them, and to receive some funding to offset some of the expenses we and others have incurred in the Safe Harbor Hotel program. Because what we're doing right now is we're putting people out, we're offering case management support without really a funding channel in place, but we believe that this community comes together and helps survivors. That's the promise and the commitment we've gotten.
Yeah. Shao, as we know that victims of sexual assault and child abuse are prone to facing social stigma, how can the family and society help the victims?
This is a hard time. When we talk about child abuse, some of the biggest advocates for child abuse victims can be
Hmm.
teachers, right? And so right now we're not in school. The teachers can't watch and see. I believe that, as a community, you have to respond and recognize the signs of abuse, the signs that children might be withdrawn from play, or if you sense something or spot something, then you say something and refer anybody who might be abused to the proper community-based organizations like ours. If it's a criminal matter, especially with children, that you call police and that you get children and women and survivors the support they need. With sexual assault survivors, I know there's a lot of stigma around that. I would say, listen without judgment, believe survivors, and tell them that help is available, because there are resources out there where they can receive and get the support. We see that transformation at the Houston Area Women's Center.
Yeah, sure. I was reading research which was saying that people who have been sexually assaulted are more likely to use drugs than the general public. Is that true?
It's complicated because sexual assault can be very traumatic, right? It's trauma. We're talking about shame. We're talking about stigma. And so what we see with trauma is it compounds, right? So if you're looking at a co-occurring issue like drugs or alcohol, it may not be surprising. Trauma is complicated and it's deep, and it requires a lot of support. But I'm an optimist, and we are at the agency have seen the power of healing, the power of hope and transformation.
Okay, Chow, please let me know, how can we stop sexual assault and child abuse?
It's everybody's problem, right? It's
Right.
a public health crisis. We come together as a community. We recognize that this spans all communities. It doesn't discriminate with socioeconomics, race, gender. We take a stand. We support others, and we support the organizations and the communities that support survivors. Believe them, listen without judgment, tell them that help is available.
And I was reading, and that says that younger people are at highest risk of sexual violence.
Yeah, sexual assault is very pervasive. We have a program at the Houston Area Women's Center. Our violence education and outreach team goes into our schools and our communities to talk about prevention, right? To talk about healthy relationships.
Right.
Because I don't think that we are hearing or we're teaching our young people enough about what consent looks like, what healthy relationships look like. That it's not okay, what sexual assault is, what harassment is. So yes, it is very pervasive among young people. February was Teen Dating Violence Awareness Month. This month is Sexual Assault Awareness Month. We push out these awareness and education opportunities so that the public can be made aware. Even in spite of this pandemic, I think this pandemic further exacerbates or illustrates, reveals how pervasive these issues are, particularly in child abuse right now. I mean, we're fearing,
Right.
we fear the worst. I mean, can you imagine what a nightmare it is to be in a home that's violent because of the stressors that we're all going through right now?
As we know that this is the stressful time. Chow, are there any measures established for psychologically counseling of the victims?
Yeah, so we offer counseling and support. We have a team of counselors who are actually doing it virtually right now. Our shelter is fully operational with a psychotherapist, case managers, counselors, residential mentors on staff. And, we check in with them every single day at Hawk. We have a great team over there who manages the clients, the women and children who are living there, currently about 100 of them. And then with our counseling staff, just speaking with our director the other day, they're doing the best they can to offer that support via Zoom and all the, the technology. We've had to sort of ramp up our technology very quickly in the wake of this outbreak, because we know that survivors still need that support from us. So we're doing the best we can to offer those support services virtually.
I have data from 2018, and this is for United States. It is estimated that 734,630 people were raped in the United States in 2018.
Yeah, and you know,
it is
what's
fearful
really
data,
sad about
actually.
that. Yeah, and it's really sad about that data
Hmm.
is what we know is sexual assault is already underreported. So, multiply that by 50%, and that's probably more of a realistic number because we have got to break the shame and the stigma. People don't want to report because who wants to go through a criminal justice system? And he said, she said, our message is always to survivors. You can come to us no matter how long this took place, no matter, whether or not you went to the police or not, because we know how hard it is to be in front of authorities and having to retell your nightmare all over again.
Right.
Just believe survivors where they are. It is a very troubling statistic.
So I must say, as April is Sexual Assault Awareness and Child Abuse Prevention Month, but I should say this will be for whole year. This
I'm
will
sorry,
be
come
for
again?
the year, I think, not only for April.
What's really sad is I think you're right. I mean, we're just, we're only, 4 weeks into this quarantine and our stay-at-home measures.
Right.
We're already seeing a spike in the number of violence cases. We are bracing for the worst. We are hoping for the best. We want people to know that we are still here to offer support. If not us, we have many sister agencies who can help as well in our surrounding communities. It's going to take all of us to reach out to our neighbors, to check on them, to tell survivors they're not alone and that there is help. And we'll be unveiling a social media campaign in the coming weeks with the city and county to reach out to survivors, to let our business community, those in the grocery stores and restaurants, know that there is a way that you can support survivors as well as a bystander.
Okay, Chow, we are going to wrap up our show, but I just want your final comment.
I know that we're all going through so much, and this is just, for us, we cannot imagine what hell it can be to live in a home with a survivor. This is a survivor's worst nightmare, to be stuck in a home with nowhere to go. But just know that help is a phone call away, 713-528-2121. You can offer wwc.org. We will offer those services virtually. If you can't get out of the house, remember, plan your safety. Know where the quick exit is. Have your phone with you at all times. If you need to leave, find a code word to a trusted family, friend, or child. If you need to call 911, if you say that code word, maybe somebody can get your help, because your safety is paramount. It's so important. It can save you your life.
Thank you, Chow. Thank you so much for talking with us.
Thank you.
Yeah, thank you. Thank you so much. So, Chow was talking with us. She is Chief Public Strategies Officer for the Houston Area Women's Center. And I think we should stop together and we should fight together against sexual assault and child abuse. So that's all now. This is Sarah Chauhan signing off. Stay tuned with the NTV Houston.